Does
Okay.
Oh.
Get back a little bit, if you don't mind. Thank you. Yeah, get my holes down. Raising children is not an easy thing to do. There are times where we are overwhelmed, face new things we haven't before, and we've all been there when we've stayed up all night long because we can't shut our brains off. It makes it extremely difficult when you have a child who is usually well behaved, sweet, and easygoing. Then, as the days and months go by, you notice a difference in your child. She throws temper tantrums over the smallest little things. She blurts out answers to questions even before you finish asking. You watch her hit herself in the head when she's doing homework because she's labeled herself dumb or stupid. My name is Sarah Doty, and I am the mother of a 10-year-old little girl who was diagnosed with attention deficit disorder 2 years ago. While I don't know the struggle of ADD, I know the struggle of being a helpless parent of a child who struggles with it. Today, I want to talk to you about attention deficit disorder, the definition, the facts, and the myths, also counseling and medication benefits. ADD affects 1 in 10 children and 1 in 25 adults. Chances are you yourself know someone who has the disorder, or at best, you at least have encountered someone who has it or is currently being affected by it. The main points I would like to make today: ADD does not discriminate. It affects every race, every gender, every IQ, every age, and every religion. ADD is not caused by moral failure, poor parenting, family problems, poor teachers or schools, too much TV, food allergies, or excess sugar. Instead, research shows that ADD is both highly genetic and is a brain-based disorder. Lastly, ADD is not benign. Those who have ADD and it is left untreated will most likely also have problems with relationships, education, the law, overeating, and obesity. My daughter Cameron was 5 years old the first time her teacher mentioned something to me about her attention span. It was at a parent-teacher conference, and she explained how she had to take Cameron aside every single day to have one-on-one time with her. At the time, the thought came and went in my mind. She was only 5 years old. Who wants to think their child has a disorder, especially being so young? I decided to give it time and just monitor the situation. Cameron did average for the most part for the next few years until 3rd grade came. It wasn't so much her grades, it was her behavior. She couldn't do homework at night. She would get mad at me, herself, anything and anyone around her. She would call herself stupid and throw papers. She would blurt out answers to questions before I was done asking the question. At this time, we started counseling. Annie, our counselor, talked with Cameron on a bi-weekly basis and eventually gave us the attention deficit disorder diagnosis. Throughout this time, we learned things we could do, coping mechanisms, and how to deal with emotions. This worked okay for Cam for about a year, but this past August, her 5th grade teachers began messaging me on a regular basis. It seems that Cameron isn't focusing, she's struggling, she's failing, and is showing frustration. This is when I broke down to one of our providers that Cameron normally sees, and she prescribed medication. This caused a lot of anxiety for me because of all the negative you hear about side effects or changing your child's personality. It was a big step, and I knew she had to take it. Since August 2018, Cameron has been on medication, and it has helped her tremendously. So much so that I cried, but now for a different reason. She could understand homework alone. The tantrums and the fits almost vanished. She seemed to think more clearly. I have guilt in not starting medication sooner due to my own personal reservations. That is why I've decided to talk on this personal journey, because in doing so, I hope that it can help others and make that have reservations as well. So what is attention deficit disorder? ADD is a common, long-lasting, treatable childhood psychiatric disorder characterized by a pattern of developmentally inappropriate inattention, motor restlessness, and impulsivity that affects approximately 3 to 7% of school-age children. Genetic factors are implicated in ADHD, but the mechanism of action is not completely understood. Twin, family, and adoption studies of ADD have supported the strong genetic contribution to the disorder, with genetic ability ranging from 60 to 90%. While there are not sufficient studies to show that counseling goes hand in hand with medication, there are plenty of testimonies that show counseling does help. For us, I learned how to talk to Cameron. She needs to be disciplined differently than my other children. Spanking her only made our situation worse. Sitting her down face to face alone and explaining what just happened and why she is being grounded has worked 100% better than spanking her and sending her to her room alone for 30 minutes. Counseling gives the person diagnosed someone to talk to who understands their struggle. It teaches the misconceptions of ADD. It helps identify personal struggles, triggers, warning signs to look for, and ideas on how to cope. Journaling is one example. The biggest problem I think society has with disorders such as ADD is some use this as a catch-all excuse to their problems or their child's behavior. It has been used as an excuse to behave in a certain way, and it questions our country's deep beliefs in work ethic. The trouble is a fine line, and the trouble is the fine line in some abusing it, and the rest who actually have a neurological disorder. Tantrums and defiance are not symptoms of ADD itself, but they are often a result of ADD symptoms. Inattention and impulsivity can make it difficult for kids to tolerate tasks that are repetitive, take a lot of work, or kids find boring. Examples of this are homework, daily chores, or being organized in any way. When kids cannot complete these tasks to the normal standard, this is when the impulsivity, tantrums, and frustrations occur. Not because they didn't get candy in the grocery store or because you tell them no. That is the difference in ADD and a child needing discipline. In ending, I hope that you now understand that ADD and the stigma surrounding mental disorders. It is hard on the children who have it and the parents that are trying to cope with a child who has been diagnosed. My hope is that more medical providers get the training needed to understand mental disorders better. It is easy to hand out medication to a child whose parent is insistent on their child needing it just because it's easier than taking the time to discipline a child. This is the reason that ADD and ADHD have not been taken seriously enough. I strongly believe counseling helps with ADD if you have the disorder. My thesis in all of this is that ADD is a real disorder, and you should take time to educate yourself and find resources if you think you yourself are struggling, or a loved one or a child is. Be open-minded, and if all possible, seek counseling first from a mental health counselor to ensure that you get the correct diagnosis. Strength does not come from winning. Your struggles develop your strengths. When you go through hardships and decide not to surrender, that is strength. Keep your head up whether you're dealing with this or you're dealing with someone who has this. The more struggles, the more strength. Thank you everyone for your time today. How long was it?
I was leaving.
Oh.
Yeah.
Oh.